Well, good afternoon, Rochester. Welcome to the July Equity Series. My name is Wafa Al Khalifa, and I work for Destination Medical Center as the Equitable Development Coordinator. I'm here with my colleague, Chao Matala, who serves the City of Rochester as the Diversity, Equity, and Inclusion Director. We welcome you to another episode, but this time we're not going to be doing a lot of the hosting. We have our colleague, Jacob Metz from City of Rochester, who will introduce the presenters in a moment here. But before I pass it to Jacob, I want to just remind everyone that you can access all the previous Equity Series episodes on the DMC YouTube channel. And then if you or your organization has any questions about the Equity Alliance and joining the Equity Alliance, or if you have any suggestions or ideas about new topics that we can have in our future episodes, please don't hesitate to contact me or contact Chao Matala. And now I'll pass it to Jacob. Welcome, Jacob.
Thank you. Welcome everyone to the first ever disability summit for our Rochester community. My name is Jacob Metz. I've worked for the City of Rochester for 2 years now on disability rights and also language access, accessibility and language access. And the entire origin of this summit, which is going to be a 3-day event now, the 16th, which is next Wednesday, and then the 23rd right after that, is I saw the City of Madison do something similar to this to commemorate Disability Pride Month, because in July, the ADA was signed in 1990, of July 1990. So it's Disability Pride Month. So we see this as an opportunity to learn more about accessibility, and hopefully it's an educational opportunity for our community members. People are experts on their own experience, and our hope is that this is an opportunity to learn from them. And it's also meant to be an opportunity for our community members and community leaders to take stock of Rochester's progress and the state of accessibility in Rochester, both now and every year. Because our hope is that every single July, we'll be able to mark the calendar to say, how far did we get on accessibility this year, and what are the things that we could work on going forward? And in that vein, here's a accessibility form I'm dropping in the chat to say what all of you would like to see the Rochester community work on accessibility by July of 2026. So today's event is going to cover just the history of disability rights and justice and understand how we got here. But before I get into that and we get to our presenters, I'll quickly hand it over to Lexi Dunn for an accessibility check. And if
Hi
you could move
everyone.
the slide there, Chow.
Hi everyone, my name is Lexi. So first, before we start, I just want to do an accessibility check-in. So of course, we understand that everyone's needs looks different. And if you need to turn your camera off, go get a drink of water, go get a snack, do whatever, turn the captions on, just do whatever is going to meet your needs. And I understand that no two ways of participation are going to look the same. Nevertheless, they are all valid.
Thank you for that, Lexi. And Chow, if you could move the slide to past disability, the data on disability, and just one more. Perfect. Okay, so just as a quick overview, just so we get a lay of the land, nearly 45 million Americans have a disability according to the US Census Bureau. So that's an incredibly large block of folks and a block that definitely deserves a lot of attention and consideration to learn more about their history and preferences. And in our community, specifically in Rochester, a little over 12,000 people have disabilities, or about 10.1% of the total population. And that's based off of a census definition, which very likely is an undercount because it only uses several specific components to be able to discern whether someone has a disability or not. So it is likely that these numbers are actually undercounts. Next slide. So to learn just a little bit more about this, in our median earnings in 2023 in Rochester, we're looking currently at a bar chart that compares the median earnings for people with disabilities versus people without disabilities. And people without disabilities out-earned people with disabilities by over $20,000 a year. So it really speaks to some of the existing discrepancies, not just nationally, but specifically in our community here in Rochester. Next slide. Similarly, we're looking currently at two ring charts for poverty status in Rochester over 2023, and it shows that nearly a third of people with disabilities in Rochester were below 150% of the federal poverty level in 2023. And that is a far smaller number for people without a disability. It's only around 10% or so. So again, a pretty large discrepancy that it matters to take stock of and to note. Next slide. So now we're going to go a little bit into disability rights history, which could be its own session. It could be its own summit. So I'm going to do my best to keep it concise. So next slide. So to just go over certain key moments in the disability rights movement in the United States, you really would need to start with the independent living movement. That grew out of deinstitutionalization, and it challenges the idea that people with disabilities need to be institutionalized in jails or poorhouses or in facilities to control patients. So the entire premise of the movement is that people with disabilities themselves are the best experts on their own needs, and that you don't need to be dependent on parents to professionals. And it promotes the idea that disability is a natural part of the human experience and challenges the narratives around dependency or charity. So I highlighted three specific people who were very critical to that movement. So first, Johnny Lacey was a Black disabilities rights activist and helped found the Center for Independent Living in Berkeley, which she later became the director of that center. So she was heavily involved in disability rights advocacy and just general accessibility issues in California and San Francisco. There's also Ed Roberts, who was created the first student organization led by people with disabilities on a college campus and called on UC Berkeley to create a more accessible environment on campus. And he founded that Center for Independent Living in Berkeley, which is a model that is spread all across the country, including in our community here in Rochester, with the Southeast Minnesota Center for Independent Living. He's frequently called the father of that movement. And then Judy Heumann. So she is someone who has really, truly had a very illustrious career with disability advocacy, both with fighting for the rights of teachers to be able to teach in New York if they have a disability and winning that case, being part of pretty big federal legislation like the Individuals with Disabilities and Education Act, and also organizing the 504 sit-in, which I'll go into now. So that refers to Section 504 of a law back in 1973, the Rehabilitation Act, and it outlawed discrimination against people with disabilities in terms of federal services or activities. And something that you'll see throughout, I think, any social justice movement, but especially with disability rights too, is a consistent fight to be able to actually get certain things passed into law, and then another fight to actually get those things enforced. So the 504 sit-ins, and we have a picture of that on the left side of people lying down in front of a bus in San Francisco. It was really meant to be able to call on the federal government to issue regulations to meaningfully enforce that law. And Judy Heumann was a huge part of that. And then the Capitol Crawl, of course, is also very famous. The Americans with Disabilities Act was stuck in House committees and Congress, and people with physical disabilities climbed up 83 steps on the US Capitol as part of a symbolic protest to pressure Congress to pass the ADA, which they did. Next slide. So some of the key legislation I just alluded to with the Rehabilitation Act in 1973. That's what Section 504 is related to. The Individuals with Disabilities and Education Act is something that Lexi will speak to here in just a second. And then the ADA is a crowning civil rights achievement. But similar to what I said before, there's a lot of advocacy to be able to get things into law, but it only ultimately matters if those rules are truly enforced and respected, and those norms are respected as well. Next slide. So as just a quick example of changes brought by the ADA, ramps and braille signs in public transit areas, emotional support animals, sign language interpreters at large gatherings like political rallies and sporting events, and reasonable accommodations. Like if someone needs a reasonable accommodation, if they're an employer, they're able to, or if they're an employee, they're able to request a reasonable accommodation from their employer, like flex time or telecommuting. And similarly for local governments, state and local governments, they're required under the ADA to have a clear process to community members if anyone needs an accommodation to be able to access a city service or program. And I really would want to make sure that we plug at the City of Rochester our form as well. So I'm going to drop that in the chat. So that link that I just dropped in the chat is the form to be able to request a reasonable accommodation for the City of Rochester. And please, please use it. Next slide. So finally, if you're interested in learning more, you can watch more about the ADA and how it came to be. There was a recent documentary from PBS called Change Not Charity that goes all into it. So I'll also drop that in the chat right now. And now I'll hand it over to Lexi. Next slide.
Hi everyone, so my name is Lexi. I have lived experience with chronic illness and disability. So I have a rare disease that, because it's rare, there's not a whole lot of medical research on it. And due to that, I actually went undiagnosed for 17 years. So you can imagine the struggle that was, knowing that there was something wrong with my body and that I was very sick, but no doctor would listen to me and just medically gaslight me. That was a very difficult time. So this actually led me to learn a lot about the psychosocial manifestations of living with a disability, because I feel like sometimes when people think about disability, they think of it as something purely biological. They fail to realize that it affects your entire holistic person as well. So prior to becoming disabled, I frankly wasn't aware of all of the inequity and ableism and hidden struggles that I would later face. And I think something that people often kind of think about is that because we have the ADA, that should allow people with disabilities to successfully integrate into the community. And the ADA, Section 504, and IDEA, they should all be thought of as the floor, not the ceiling, because the only way that we can ever reach true disability justice is to continually amplify the voices of people with disabilities and then expand upon those previous legislations. So you can see the story, the picture that I have on the left was when I had one of the surgeries for my heart. And I had a little sign that I hung up, and it says, "She leaves a little sparkle wherever she goes," because I feel like that definitely personifies who I am as a person. So we can go ahead and go to the next slide, please. So as I mentioned, I've dealt a lot with ableism. And I think something that's really important to point out is that oftentimes when people think of ableism, they only think of overt ableism, something that is glaringly obvious that's ableist. For example, if I was an employer saying, "I'm not going to hire someone that's disabled because I don't like disabilities," obviously that's ableist and extremely discriminatory. What we often don't think about is subtle acts of ableism. And so you can see the picture on the right. It says make education accessible. When I was advocating for the Educators Awareness on Ableism bill, I opened up a notebook and I took an inventory of all the different times that I had been on the receiving end of subtle ableism while in the school system. And it could be simple things like making ignorant comments such as, "I wish I could stay home all day too," or "I wish I was disabled so that I didn't have to go to school." That's ableist. And another thing too is ignoring or downplaying instances of bullying towards students with disabilities, because it then teaches those other students that it's okay to other students with disabilities, and it reinforces the idea that you can be ableist as long as you use the excuse that you didn't know any better. All right, so talking about predatory policies, there are things such as asset limitations. So, for example, because I have a disability, I cannot have more than $2,000 in my bank account at any time. And if I do, I risk losing my benefits. And that goes for all people that have disabilities that are receiving benefits. Another thing is called the marriage penalty. People with disabilities that receive benefits cannot get married without losing their benefits. Sub-minimum wage. In the United States, it's perfectly legal for businesses to pay people with disabilities sub-minimum wage based on the fact that they have a disability. And this is something that businesses get through a 14C certificate. And a quick fact is that Minnesota actually has the highest per capita rate of these 14C certificates, which is something that disability advocates have been trying to overturn. Another thing is that there's loopholes within the ADA. It's not as strong and as enforceable as you would think it is. For example, a lot of the time, polling places for voting are in churches, and churches by ADA are not required to be accessible. So this means that polling places can then discriminate against people with disabilities by not being accessible to them. So when we're talking about ableism, it's important to understand that disability is just part of the human experience. It's a neutral and natural part of being a human. We need to stop thinking about it as something that's inherently bad or considered the worst case scenario. Next slide, please. So when we're thinking about how do we actually view disability, there's three main models that I'd like to talk about. The first one is the medical model. So this is when you view disability as something that is a sole result of their diagnosis and their perceived defects or deficits. The idea within the medical model is that we must fix disability because disability is inherently bad. This really fed into the idea of eugenics as well as institutionalization. So then after that came the charity model, which was thinking people with disabilities, they're very helpless, they should be pitied, we should focus on helping them, but only in ways that we determine are best. So this really undermines autonomy and person-centered thinking and planning. So out of that came the social model, which is what a lot of disability rights activists today tend to lean and gravitate towards. So the social model views disability and says that the person's disability is exacerbated by the inaccessibility of their environment. We must focus on societal accountability for accessibility, inclusion, and person-centered thinking. So for example, if you were to try to go into a grocery store and say there were 3 steps to get up, if you thought about it through the medical model, you would say that the reason the person can't get in if they have a wheelchair is because they're disabled, they have a wheelchair, there's steps, they can't get up them. But if you were to view it through the social model, you would say the reason that they can't get in is because there's not a ramp. So it's really about changing the way that you view, think, and want to help people in the disability community. All right, next slide, please. So specific impacts of positive disability supports in legislature. I know that earlier in the meeting, Jacob had talked about the IDEA Act, which essentially allows children in school systems to receive a free and appropriate public education. So they cannot be in a very restrictive environment, and it also gives them the right to have accommodations. When they go to college, those accommodations are then covered under Section 504 of the Rehabilitation Act. So one big proponent that's helped me in college is being able to get accommodations to help with my disability. So earlier I spoke about asset limitations. In 2014, something called Achieving a Better Life Experience, or ABLE, accounts were founded. And essentially, this is for people that receive benefits, and you can use it as a savings account and put money in there that otherwise cannot be counted against your asset limitations. Of course, there are limitations on how much money you can put in there. And another thing that limits they require you to only spend that money on disability specific purchases. So that's something that we could really use fixing on when it comes to disability advocacy. Another thing is the Americans with Disabilities Act. So when I go to get a job, I can ask for reasonable accommodations. So centers for independent living have also been very helpful for me as well. I know that dealing with the complexities of either the medical system or the benefits system or whatever system you have, they can help you fill out paperwork and kind of understand the process and have someone on your side to help you. Another thing is public accessibility and inclusion. For example, If I were to have come into school today, I'm able to get into the door simply because it's accessible. There's a door push button, there's a ramp, it's accessible, and inclusion is also the way that we think and the way that we accept other people into our community. So person-centered thinking is also stemming off of that social model of disability instead of the charity model where we decide how to help people with disabilities. Person-centered thinking asks the person with the disability, what do you want? How do you see your future? What do you want to do? So it really changes from telling them what to do to then giving them the autonomy to choose what they want to do. Another thing that's been very positive is the ability to access advocacy organizations like the ARC of Minnesota. All right, next slide. So before I leave today and pass it off, I want to just go over the disability justice framework. This was created by an organization called Sins Invalid. And the four main ideas within the disability justice framework is that all bodies are unique, valuable, and essential. We all have strengths and have needs that must be met. We are all powerful, not despite the complexities of our bodies, but because of them. And all bodies are confined by ability, race, gender, sexuality, class, nation state, religion, and we cannot separate them. Alrighty, thank you so much for your time, and I will pass it off.
Hello, everyone. My name is Linda Dreesen. As an accessibility check for my friends who may be blind or low vision, I am a 60-year plus white female with dishwater blonde medium length hair. I am wearing purple glasses, and I'm also wearing a coral colored blouse with a silver zipper. In the background, you can see my home office. I currently use she, her pronouns. Next slide, please. I wanted to take a little different approach to the conversation. While Lexi shared her personal story, my story begins a long, long time ago. This on the screen is a picture of 4 young children lined up by height, dressed in our Sunday best outfits. It was taken somewhere around 1964, and it happened to be from my brother's first communion. I am the little blonde in the front, and I was about 2 years old at the time of this picture. The reason I'm sharing this picture is it shows what disability looks like in my family at that time. If you look at this picture, it's very difficult to be able to know which of my siblings experienced a brain injury at 8 months. And I want to share my story about what that meant for our family and what that meant for me growing up, and then also how that influenced my direction going forward. I have permission from my family to share our story. I do not have permission to point out which of my sisters is the one that had meningitis at the age of 8 months old, which the story goes, my sister was very sick, and back in 1958, 59, when you had an illness, your doctor came to the house and checked on you and was able to give you care while you were at home. Unfortunately, my sister's typical doctor was unavailable the day that my mom needed help. And the doctor who showed up looked at my sister laying in the bed and said, "There's nothing wrong with this child," without looking at or doing anything to check temperature or anything about her, looked at her and said to my mom, "There's nothing wrong with this child. You are an overprotective mother," and he left. The next day, my mom was able to contact our regular doctor, and at that time, the doctor immediately sent my sister up to the University of Minnesota for hospital care, and she received surgery, which released the pressure on her brain because of the infection that was happening because of the meningitis, and as a result, my sister ended up with a brain injury. How things were experienced back in 1958 when there was disability. My parents were told that they didn't expect my sister to have much ability based on the surgery and the infection and how difficult things were for her. And they were told to put her in an institution. As you can tell from this picture, my sisters are standing in this picture, which means my parents chose not to do that. They brought my sister home, and they worked, as parents do, to do what they could to offer the best life that my sister could enjoy, particularly at a time when there were no support systems for people with disabilities. My family did the best that they could. We supported each other. We worked through the challenges that we experienced. But one of the things that was going on at the time that my sister went into school is education wasn't made accessible for her. She didn't have the opportunity to start kindergarten when others did. She didn't have any pre-kindergarten supports at all for education. Recently, one of the kindergarten teachers in Faribault, I grew up in Faribault, passed away at the age of 100. Her name was Kay Bodke, Mrs. Bodke. She was a great teacher. Unfortunately, my sister had a kindergarten teacher for years because she didn't have access to her grade level when she started school. Thankfully, Mrs. Bodke was a wonderful person, and my parents worked hard, and my sister got a chance to pretty much live a typical life, however, not an easy life. One of the things growing up in Faribault is, for those of you who don't know, I call it the City of Disability Schools. Back then, the Faribault State Hospital existed, and when I was growing up, it was called something that I won't talk about today, but it was not a very kind representation of the state hospital. But there's also the school for the deaf, and there's the school for the blind. And so growing up in Faribault, I had the opportunity to experience disability in ways that not everybody gets to. We regularly interacted with people who use sign language to communicate. And so I feel very blessed that I had the opportunity to meet more people with disabilities along with my sister, because in school, that wasn't necessarily the case. So where are we now? So my sister Corey, she got married. She has 3 children. She essentially received no services until we struggled with helping her keep a job. Because of her brain injury, she struggled with some rules about working. And so she consistently lost her job. And when she turned 50, we decided to get her tested so we could try and get her some Social Security supports, because she needed something to live on because she was consistently losing her employment. And so we were able to get her Social Security. But then, as Lexi talked about, that limited her access to some things in the community. Like I said, she got married. She has 3 children. She currently lives in Texas. And we continue to struggle with what she lives with regard to her brain injury. But overall, we're a great family. And as a matter of fact, tomorrow I'm meeting all of my siblings at Itasca State Park, and we're going to spend the day together. So as a family, we have always supported each other and continue to do so. Next slide, please. On this slide, you are seeing a slide for Chapter 245D, Home and Community-Based Services Standards. I'm going to talk a little bit about how we've gotten to those standards today, and my own experience working in the disability realm in the process of getting to where I am today. I started back in 1987 working in semi-independent living. I was finishing my master's degree in counseling and psychological services from Springfield College in Massachusetts, but I was doing that in Faribault. And this, I needed a job. I needed to be able to pay for my student loans and get ready for my upcoming wedding. And so I took a job that was, fit me, because I had a background as a person who had a sister with a disability. For those of you who don't know, semi-independent living is helping people stay in their own homes. helps pay the bill or help work with them to pay bills, grocery shop, do the things that they need to be able to be in community on their own. After I got married, I struggled to find a job with my master's degree. And so knowing that it's always easier to get a job if you have a job, I looked for what I could to get a job, get employed in 1987, which happened to be a recession. And I took a job as a direct support professional at an intermediate care facility for people with developmental disabilities and intellectual disabilities. It was called something different. And again, it's a term that we no longer use. So I'm going to forego using that term. But at that time, Lexi talked about the medical model. The intermediate care facility was all about the medical model. It was truly when the state hospitals closed in the 1970s, the ICF was set up as a way to get people in community, but essentially they were just tiny institutions. Most of the work at the ICF was all about the programs and it was intended to fix or respond to the poor conditions at the state hospitals and the significant amount of abuse, neglect, and exploitation that happened at the time. So as I said, most of working at an ICF was about programs, teaching people how to brush their teeth and wash their hands and use a toilet, behavior modification, lots of work that was focused on keeping people from hurting themselves and hurting others. From there, I moved to a sheltered workshop. And again, for those of you who don't know what a sheltered workshop, it is segregated work. It is intended for people with disabilities to learn work skills with the hope and intention that they will eventually find a job in the community. As Lexi talked about, many segregated sheltered workshops utilize a sub-minimum wage system, which means that most of the people that work there are making less than minimum wage. And oftentimes self-advocates, people with disabilities, have felt stuck in segregated work in a sheltered workshop. A lot has changed over the years, but back in 1989, 88, 89, when I was working in the sheltered workshop, pretty much everyone that we were working with was in the shop, and anyone who was working in the community was basically on a crew and also continued to make sub-minimum wage. From there, I started working with injured workers because I had decided I wasn't going to work in the disability field anymore, and I wanted to, or in the IDD field anymore, and I wanted to try something different. And the reason I bring up my experience working with injured workers is kind of to the point that disability can happen at any time. For my sister, it was 8 months old. For many people, it's a work injury that changes overnight. Sometimes it's a car accident, but I don't know that all people, I think we all believe that it's never going to happen to us. And I think it's important for everyone to realize that disability can happen for many. While I was working with injured workers, the ADA had been signed. And at that time, the work that I did was to help employers get prepared for bringing workers back to work and using reasonable accommodations to do so. I took 4 years off to be a mom, stayed at home, took care of my kids. And then when they were all headed off to school and moving on in their lives, it was time for me to try something new and different. And again, where do you always find employment? In the disability field. I took a job at Possibilities, which is a day program in Rochester. I worked there for 16 years. Possibilities back in 1997, when I started there, was something called a day training and habilitation center. It was intended at that time that all people with disabilities had to be working in order to receive services. And it was a counter to the ICF. So if a person lived in an ICF, per regulation, they had to be out of the house at least 6 hours a day at a day program. And Possibilities happened to be one of the day programs in Rochester that was providing those options. Thankfully, while I was working at Possibilities, I worked for an amazing executive director. His name was John Flanders, and John taught me all about what it meant to be person-centered. Back in 1997, that was a new concept. And we looked at how we could make sure that people got to live the best life that they could, trying to help find jobs for them in the community that was based on their interests and needs, and not just based on the assumption that all people with disabilities wanted to clean or work in a wash tables or put widgets together. And then not finally, but my next step was I took a job as the executive director of Bear Creek Services, which is a residential provider in Rochester. As a matter of fact, one of the longest residential providers in Rochester. Both Possibilities and Bear Creek Services came out of the ARC. At that time, it was the ARC of Olmsted County. They were started by the ARC and both continue to function today. Again, as the executive director, I was able to work with our employees to bring person-centeredness to people who receive services there. And we worked both with folks who lived in our group homes, and we worked with people who lived in independent living. I could go into the challenges that providers are facing right now, and I do want to at least mention the fact that cuts at the state of Minnesota and the anticipated cuts to Medicaid from the federal government are going to be incredibly difficult to weather by providers that are providing disability supports. The reason I posted the 245D and what's working, what's not working, the home and community-based services standards, is because that is the standards that we all had to work under. The state of Minnesota decided in 2013 to try to make the state of Minnesota a person-centered state, and the 245D standards were their attempt at doing that. But you can see here that there's a lot of regulation to providing services for people with disabilities. There is still a lot of sense of protectionism and helping people achieve their best life is done by one person at a time. And systems don't often function very well when you're talking about doing things for people. But overall, the state of Minnesota is working hard to try to make that happen. And I want Buff to have enough time to talk about what she knows. So I'm going to end it there. Thank you for your time. And it's all yours, Buff.
Thanks, Linda. I'm Buff Hennessy. I am the Director of Statewide Grants and Initiatives for the ARC Minnesota. I'm going to talk a little bit about trying to share my story through and share some history and talk a little bit about where we've been and where we've gotten to and how and why. And I will try to do that quickly so we have some time for questions at the end. I have worked with people with disabilities in the disability field for 55 years. I'm a white woman, several years older than Linda, with white hair, and I'm in my office, and my background is blurred, so you don't see my messy desk that's behind me. You can go to the next slide. Just talking a little bit about the evolution of disability services and how people with disabilities have been treated in our society over the years. So, and I'm not going to go into a lot of specific dates, and a lot of these don't have specific dates. The evolution occurs and things move forward, things move back, things move forward, things move back. But clearly in the 1940s and before, there were no community-based services, and there were very few services at all for people with disabilities. And when there were services, it moved to a state-controlled model. So your option was to place your family member in a state institution. Very often, families had to give up their parental rights and have their family member become a ward of the state in order to get any supports that they needed. And it was a system that people accepted at that time because there was nothing else. Eventually, people started saying that was not the way they wanted their family member to live. And so there were community-based services that were begun. There was a lot of provider control at that time. There had been an attitude when it shifted from the state to providers are providing these services now. This is what we have to offer. You can take it or leave it, and you should be grateful for what you get. And the reality was that people were grateful, and they were grateful because they were getting some supports. But people did not ask families what they needed. They didn't ask the individual what they needed. It was very controlled by outside entities. Eventually we started using family-centered services where families became part of the person's team. We still had that model that Lexi referenced where we were deciding for people what they needed and what was best for them. We didn't really acknowledge either the skills or or what people with disabilities brought to their communities and to their lives. But families were more involved, and so we'd made that step in the evolution. Then we moved to the self-advocacy centered services, where we started teaching people with disabilities how to become self-advocates, how to start to speak up for themselves, how to take part in the programs and services that they were receiving. And then I think now we're more into what would be considered self-determination services, where people with disabilities are intended to be at the center and have an ability to be part of the decision making about the services and supports that they need and that they are able to get. So you can see that we have moved, and we probably will move to another method of service at some point, but we've had a lot of evolution in how our services have been provided for people. If you go to the next slide, I'm going to touch on just some significant events that have led to change. And I'm going to focus most of this on Olmsted County and my experience. And I've been, I said that I'd worked in the field for 55 years. 44 of those have been with the ARC in one capacity or another. And I started out at the ARC in Olmsted County in 1980. Prior to that time, in the 40s, when I mentioned that there were no services, parents who said, I'm not placing my family member in a state hospital, and I'm not taking my family member home just to love and pretend that nothing is going on. And so parents started organizing and connecting with each other. And actually in Olmsted County, some parents put an ad in the paper and said, we have a family member with a disability. Is anybody else out there who has family members and who wants to get together and wants to talk and share? And so people started making those connections that way. They started forming peer support with each other, providing support to each other. And actually, families got together and hired their own staff to provide some learning opportunities for their family members. As they started that, that same kind of activity was going around in the rest of the state and actually in other parts of the country. And the ARC movement formally began in Minnesota in 1950 with its first national convention in Minneapolis. And so we've been a leader in that movement throughout its existence. The families, and at that time, really a lot of the work was done by moms, as our society was back at that time. The dads were employed for full-time and the moms took care of their kids and did the volunteer work. And they started recognizing that they were taxpayers in their community and their taxes were providing services in their community, but they weren't providing services for people with disabilities particularly. And so they started working together and got the Day Activity Center legislation passed in 1960 or 1961. And one of the first pilot programs was held and continues to be in Rochester, and Linda referenced that. It's now known as Possibilities, and it's evolved over the years. When I first worked in a day activity center when I was in college, we served almost all school-age kids, which was surprising to me, but public education was not mandated yet at that time. Public education was not mandated until the middle of the 70s. A lot of schools did serve kids who they termed educable prior to the mandate, but those students or those kids who they termed trainable were not required to attend school yet, and so they were served in day programs. Once mandated public education occurred in the mid-70s, schools needed to serve all kids, but very often they were serving them in very segregated schools and a lot of times not in their home school districts. In 1980, in the summer of 1980, 30 parents from Rochester filed a complaint with the Office of Civil Rights out of Chicago about their kids being forced to attend segregated schools and not having the same opportunity to go to schools with their siblings. That resulted in an agreement that the ARC monitored for 3 years to set up a plan for Rochester to no longer have segregated sites and to have all kids go to schools in their neighborhoods and with their siblings and where other kids went to school. Another piece of that was smaller towns very often combined together and sent their kids to a single location. So another effort that we did was work with local school districts to have them set up programs for kids with disabilities in their home schools. So kids, brothers and sisters, were not being transported 30 and 40 miles to go to school in a different town to only be with other kids with disabilities. So those were a couple of the education pieces that were pretty powerful in making the change in the way that we served kids with disabilities. The closure of the Rochester State Hospital has been referenced. That was in 1982. For the people who lived at the state hospital who had developmental disabilities, they had the opportunity to move into community group homes and to other settings that were established for them. People with mental health issues did not have a lot of those same community services, and so there were differences in how that closure impacted different populations of people with disabilities. Part of the evolution that we've had is the development of community services, including group homes, which we've referenced, including park and rec programs, community education programs. People are employed in the community, and the ARC, one of the things that we saw as our role during those early years was to listen to people about where there were gaps in services and find ways to develop programs and services that would meet those gaps. And it might be starting a program and spinning it off to a local group. It might be working with other entities in the community to develop those. I mentioned self-advocacy and self-direction. Those were initiatives that we've led in this part of the state, and those efforts continue. And now we really are focusing on, and Lexi mentioned, the disability justice movement. Let's go to the next slide, please. So disability services today, obviously, a lot of progress has been made. People with disabilities are living and working and participating in their communities. But there also continue to be a number of challenges and more growth to happen. There are biases that still exist against people with disabilities. The workforce shortage is a critical issue, not only in the disability arena, but in most of our, in a lot of our community. Cultural diversity and responsiveness, our communities have changed, but our service design and service models have not necessarily changed, and so don't necessarily meet the needs of people with from a variety of cultural backgrounds. Lexi mentioned people being in forced poverty. If you need public supports, you have income limitations and asset limitations that force you into poverty. And Linda also referenced the disability services are heavily reliant on public funding, and though there are major threats to that funding today. I feel like I talked really fast there, but we want to leave some time for questions, so I will end with that. Thank you.
Thank you so much, Buff. And I want to invite everyone to utilize the chat if you have any questions or comments, or if you would like to unmute yourself and share your question.
And if there's anyone who has questions who's at the Bear Creek Watch Party, Kyle, just please let us know and we can get to that.
Mhm. And Jacob, are you able to do a formal introduction of the three speakers since they finished their presentation? I was hoping that you would do that in the beginning so everyone can see their faces and see their names as well.
Yes, we had Lexi Dunn, a self-advocate and also a student at RCTC who started first. We also had Linda Dreesen second, speaking on her specific experience. She was with Bear Creek Services for years and now is the Region 10 Quality Council head and coordinator. And I am immensely grateful to her for all the ways that she's taught me about the specifics of accessibility within Rochester, and then also Buff Hennessy, who has been the last speaker who was a longtime advocate on any issues related to accessibility in the Rochester community, and we owe quite a debt to her for all the work that she has done up until this point.
Perfect. Thank you.
And I saw that we had a question to spotlight those speakers, so I don't know if how many we're able to spotlight at once. I thought we were only able to maybe spotlight just the sign language interpreter, but it seems like we are able to spotlight some of those additional speakers. But do we have any questions at all from the group? I see one from the Bear Creek Watch Party. Would any of you be able to share about the Remembering with Dignity project and Corey Hill? So if anyone wants to jump in to answer that question. I see Buffy unmuted.
Yep, I can take that. So when after the Rochester State Hospital closed, well, when the state hospital was in operation, people who died while they were living there were often buried at the cemetery that the state hospital operated, and there were actually two different cemeteries. And they're by Corey Hill. And several years ago, I was part of a project along with a number of other local people, but a statewide initiative to recognize people who had lived in state hospitals. When they were buried with grave markers that were cement cylinders with a number on them. And there was no acknowledgement of their name or that really that they were people. And so the Remembering with Dignity project was an initiative. There was some legislative funding initially, but was an initiative to install gravestones at each one of those cemeteries. And so we had a community group who did the research to find the names and the locations of every person who was buried in the state hospital cemetery, and to purchase gravestones to do landscaping at the Quarry Hill Cemetery, put up a kiosk that had some information about it. That same initiative happened at a couple of the other state hospitals, but has not been completely completed in all of them. But it was an initiative to recognize that they were not numbers who were living and dying at the state hospital. They were actually people.
you for answering that. Oh, Linda, I see you have your hand raised.
Sure. I just wanted to recognize a couple of the questions that are in the chat too. I'm not going to speak on what Buff talked about because she knows way more than I do. But as far as Brian asking about the greatest challenges in the city of Rochester right now, it almost also goes along with Dan Doring's question, for me at least, about what are the potential funding cuts going to be.
Now, Linda, and I apologize for interrupting. Maybe I'll read the question. So since the
Okay.
question is going to be recorded, and we want the question to be available for viewers later. So the question is from Dan Doran. He said, "This is very helpful, and I am very grateful for all the speakers. What aspect of potential funding cuts concerns our speakers the most?" And go ahead, Linda.
Okay, thank you. I appreciate you doing that. So for me, having been the executive director of a nonprofit organization that supports people with disabilities in living situations, I can speak to the fact that the cost of doing business far out exceeds the amount of reimbursement that is being received from the state of Minnesota to cover person-centered, meaningful supports for people. My concern is that it will be really easy for services to end if the funding doesn't exist to be able to pay for staff, which is the greatest problem we have, is there's just not enough employees to do the work. So I'm concerned how those cuts are going to play out moving forward, and whether or not service providers are going to be able to continue to remain available to people with disabilities. I want to just make a comment too, that the idea of institutions has never gone away. In my tenure at Bear Creek, I had at least 2 different entities say to me, well, wouldn't it be better if we just moved everybody back into institutions? At least then they would have a place to live. And I would hope that the response from the community would always be, no, community is the most important place for people to live, regardless of what their disability is. So that's my response.
Thank you, Linda. We'll go ahead to Lexi.
I wanted to answer, I'm trying to find the question. I believe it was
Brian's question.
about Dan's question.
Oh, okay.
He asks, what aspects of potential funding cuts concerns our speakers the most? I would say, as someone that has a rare disease, of course, anything with medical research and having grants that are being funded to find either new drug trials or just learning more about the disease itself. Something that's common with my disease is there's a 17-year average diagnostic delay. So if you were to start having symptoms tomorrow, because there's not a whole lot of research and doctors that are specialized and trained in testing and diagnosing, you most likely would not get a diagnosis for about 17 years on average. And that's really scary, especially for children that are on Medicaid. We know 50% of children in the United States are on Medicaid. And knowing that they might not have access to those specialty doctors to then get a proper diagnosis and get connected to treatment is especially alarming. Another thing too is that when I turn 26, I'll be taken off of my parents' insurance and I will be put onto Medicaid, because since I only work part-time because of my disability, I will not have benefits from having a full-time job, which is very common for people with disabilities. Most people with disabilities work part-time as opposed to full-time. So having medication costs as well as insurance. And another thing too is SNAP and EBT benefits. As we know, the majority of people with disabilities are in poverty and rely on things like SNAP and EBT. And if those are going to be cut, it's going to get to the point where you have to choose between paying bills or eating dinner, frankly. And that's what scares me the most.
Thank you, Lexi. I want to be respectful of everyone's time. I do see Bear Creek has their hand up, and we will take your question. But before we start losing people at the 1 o'clock time, I just want to read this comment in the chat that was shared about the rest of the Disability Summit sessions. The next session will be on Wednesday, July 16th from 12 to 1 p.m. And it's going to be a lived experience panel of community members. And also the address of where the session is going to be hosted, or if people would like to attend via Zoom, there is a link in the chat, and I will make sure to send that out as part of the presentation and a follow-up to everyone who's attending with us today. And then we'll go to Bear Creek Watch Party with your question. Go ahead.
Hello, I'm Senator Carla Nelson. Glad to be here in person today and get to see you also on the screen. And I just wanted to mention how much I appreciate the history that you went through today. And I will tell you, it rekindled a lot of memories of my own. And I thought I might just briefly share with you a little bit about that. Um, my mother was a teacher who worked with students with special needs in the early 70s. And one of the things I noticed as I was a junior high kid at that time, that my mom's students, when they would go out for recess along with my junior high friends, actually they were being bullied. They were being teased horrifically by some of my peers. What I ended up doing was my mom allowed me to come in during my recess and work with her students on a Peabody learning language abilities, which was a wonderful thing. It gave me an opportunity to work with her kids. As it turns out, I ended up becoming a special ed teacher myself. And I graduated in 1975. And it was the ARC of Warren County, Iowa, that had a scholarship that helped me as I went to college and became a special ed teacher. I'm telling you this story now and thinking about that timeline of 1975. And I want to tell you something that happened just 2 weeks ago. 2 weeks ago, I had I hate to say it, but my 50th class reunion. I know it's hard to believe, but lo and behold, one of my fellow students who I knew but never really followed up with her, didn't know what she did after high school or anything. And she came up to me and she said, Carla, she said, because of your mother, I became a special education teacher. I was sent to where your mother was teaching kids, and it was a brown house next to the junior high school. And she said, I couldn't believe we didn't even know these kids. Some of them were here. So she became a special ed teacher. Now she's a professor at one of our universities, teaching others how to be special ed teachers. And so I just share that story to say that we have come a long way. We have come a long way, but believe me, we're not going back. We are not going back. And I appreciate the history that was shared today. And I know Buff and Linda particularly have been so involved. Know many of you, but I appreciate all of you coming to the Capitol to bring your stories and tell us what's needed. Maybe when we see each other next month, I'll share a little bit about some of the things that were accomplished at the Capitol that I think will be helpful for all of you and for all of our friends who have any type of disability. So I just say we've come a long way, but we've got a long way to go. And thanks for sharing your history.
Thank you. Thank you so much. There is a question specifically for Lexi. Do you live on your own, and do you have plans for the time I'm trying to read when they are not able to assist you in the future?
That's a really great question. I have lived on my own since I was 17, and honestly, I don't even know how I made it work, but I made it work. And when I was, I believe, let's see, 19 or 20, I met my current boyfriend and we moved in together. And one thing that's scary is that just the fact that we live together can jeopardize my benefits, even though we are not married. I can't get married to him because I will automatically lose my benefits. And once I turn 26 and I am taking off my parents' insurance, it is a very scary thing to think about because having a rare disease, I require a lot of specialty doctors. And frankly, I don't think that all of that's going to be covered on Medicaid. So I'm either going to A, have to go on to my boyfriend's insurance, or B, figure it out like all the other people with disabilities that are on Medicaid that have to choose between healthcare and bankruptcy. When I was a child, my mom actually had to file bankruptcy because of how expensive my medical bills got. And I do worry that that will happen to me and that could possibly be a reality. But as for the question, I don't have a very great answer because unfortunately, with the way that disability justice is right now, there is no answer for people like me. Thank you.
Thank you, Lexi. And maybe this is the final question. I'll read it after chat. It inspired a question that I had that I have on my mind, which is the question was from Brian, and maybe it's for all the presenters to end this session with a quick answer from each one of you. What do our presenters see as the greatest challenge in the Rochester community? And as you are thinking of that challenge, also, if you want to share maybe a way to solve that challenge or a solution. So I will pass it to Linda, and then we'll go to Lexi and Buff after that.
Wow, that is a huge question to answer. Let me just tell you what we are working on right now as Region 10 Quality Council. We've got three particular areas of focus. Transportation, getting around in Rochester is actually pretty darn good in comparison to other parts if you live in the country or whatever. But nonetheless, transportation continues to be a challenge for people with disabilities being able to have access to their community when they want it. Weekends, if you use public transportation, it only runs from certain time to another time, particularly if you need wheelchair accessibility or other kind of accessibility. Getting around after a certain time at night or at certain days of the week is incredibly challenging. So it keeps people out of community and keeps people from being able to do the things that they want to and need to do. The other thing is affordable, accessible, and I do mean accessible housing. As Lexi said in her presentation, the ADA is the floor. It is not the ceiling, and it does not respond to what people need in order to have accessibility. So those are two of the areas that we're working on. And overall, we continue to work on what can we do to address the workforce shortage for providers. That continues to be a problem and is a continued concern for me.
Thank you, Linda.
Alrighty, so of course that's a very loaded question, and I feel like I could go on all day with all of my answers, but I will just reiterate what Linda said with transportation. Something that I do appreciate is that I live right by a bus stop that goes directly from my street to the college campus that I'm taking classes at. And one issue is that in the winter, my wheelchair obviously cannot go through the Minnesota snow that we get and to the extent that we get it. And so I use what's called a paratransit service. And there's many, many issues with this service, such as riders not showing up sometimes. The fact that you have to schedule rides 2 to 3 days in advance. I'm in my 20s. What if my friends call me and they say, hey, let's go to the mall? Sorry, I gotta wait 3 business days before I can say yes. Another issue is housing. Right now, I live in a house that's most definitely not accessible. I have a basement where the laundry is, and I can't go down there by myself because frankly, it's not safe for me to go down the stairs, and then there's a concrete floor. And so looking for accessible and affordable housing is essentially non-existent in Rochester. And that is something that we've been working on with the Regional Quality Council, and NOAA Rochester is trying to create an accessible and affordable housing database. Another issue I would say is employment. And this isn't even just Rochester specific, but you'll see when you apply for jobs, a lot of the times it will list one of the requirements as the ability to lift 25 pounds or more. I frankly don't know why that is a requirement, but in my opinion, it is ableist and it helps the employers sort out disabled applicants and basically toss them to the side. Because if I can't lift something, I'm automatically not even going to be considered for the job, even though I'm great at what I do and I have a significant passion for disability advocacy. One last thing that I'd like to touch base on is when I first moved to Rochester, I had gone into Peace Plaza. As y'all know, Peace Plaza is not accessible because there are loose concrete pavers that are all over the floor. And if I'm using my walker or if I'm using my cane as opposed to my wheelchair, it's very dangerous. I can fall. Part of my condition is that I pass out a lot. And so if I pass out on these concrete, like it's not safe for me. And when I was in Peace Plaza, they had a informational booth on Rochester and things to do in Rochester. And I asked the guy that was working in the booth, I said, do you have an accessible itinerary of things you can do in Rochester? And he said, no, we've never even thought about that. And that really surprised me, considering the fact that we have the Mayo Clinic, which a lot of people with disabilities go to for medical treatment. I feel like Rochester, being Med City, should hold itself to an extremely high standard of accessibility. Thank you.
Thank you, Lexi.
I will try to give a quick answer. And I would say that my answer is a little bit broader, where disability services are very dependent on medical assistance, Medicaid for funding. And our system has been set up around that. And with potential reduction in Medicaid dollars coming to Minnesota, our legislators are going to be forced to look at how we replace those dollars. And I think that that there's a risk to a lot of our services, because there's a trickle down. If they need to replace those dollars with something else, what are they not going to fund? And I think that one of the pieces around that is having the public understand that disability issues are not specifically for people with disabilities. Disability issues are community issues, and the community needs to think about people with disabilities as being part of their community, and it's their responsibility to understand that and to advocate for that. And if we provide the supports that people need, whether you have a disability or not, our communities are stronger. And so I think one of the things that we can do as a community is to have people remember about people with disabilities, and to look at it as a community issue as opposed to a disability only issue.
Thank you so much, Bev. Thank you, Lexi, Linda, for presenting today. And thank you, Jacob, for introducing us to our presenters today. We really appreciate all the information, all the history that you shared with us. And thank you for utilizing the Equity Series as a platform to kickstart your summit, and hopefully for the rest of the audience that they're able to check out the rest of the sessions that you have scheduled for the summit. Thank you so much. And I just want to remind everyone that our next episode is going to be August 13th. And until next month, I hope you all have an awesome summer, and thank you so much for joining us.